So, ladies and gentlemen, Susan Weisser. Thanks, Sechin, and thanks, Gar, for those words. I too would like to acknowledge the traditional owners of the land on which we're meeting, the Wiradjuri people, and pay my respects to elders past and present and future. Can I also acknowledge the sponsors for the forum for the next couple of days. It's been made possible by their sponsorship, and I do really like to acknowledge and thank all of those sponsors who are listed on the program. I'd also like to thank Sechin for the work that she's done in putting together, I think, a very high quality program, so hopefully you're going to enjoy the next couple of days. We will look forward to getting your feedback around whether this format works better for you in terms of having a sort of couple of day event and giving people time to travel in the morning and travel home in the afternoon, and hopefully having some time to interact over dinner tonight. So we will look forward to having your feedback around that. I'm going to give my usual update around what's happening in the district and where we currently stand on a range of things. Hopefully somebody will keep me to time, because as per usual I've got a lot of slides, and if I'm running out of time somebody will give me some signals on where we're up to. Service delivery, just to let you know, in terms of where we're up to with activity, and these figures that I'm going to quote for you are year to date to the end of February. We're just working on the March results at the moment. So 47,855 people admitted through our hospitals to date, so that's up 691 on the same period last year, about 3.5%. In our sites outside of the two base hospitals, they're about 1% higher than their expected activity and 3% above their same period last year, so still continuing to have increasing demand for our services. Occupied bed days, we've had more than 247,000 people in a bed on a day, and that's up over 1,000 people more than the same time last year. Our length of stay for patients acute patients is running at pretty much the same level as last year, which is about 3.6 days. We have an occupancy rate of about 73% across all of our facilities. In our residential aged care beds, in our MPS sites, those residential aged care beds run at 92% capacity. On a non-admitted basis, so people seen on an outpatient basis or through community health services, we've had more than 500,000 people through our services to the end of February, so 589,000, and that's up near 3.8% on last year. So continuing to see increasing demand across all of our service areas. But we continue to perform well on our performance indicators in terms of how timely people get treatment. So this is across our district for surgical category 1 patients who are the most urgent patients for needing surgery, who need to be done within 30 days. We have 100% of people being done within that 30-day category if and that category is determined by their referring specialist or doctor. It's not determined by the health service. Surgical category 2, which are people that need their surgery within 90 days. The benchmark is to have 97% of those people treated within 90 days, and we're at 98%. People in surgical category 3 who need their surgery within 365 days. The target for that is 97%. We are a bit behind that in 90%, but I can tell you from where we were a few years ago, that's quite a significant improvement from where we were. We have a range of strategies that continuously look at how we improve, I guess, the timeliness and efficiency of our theatres. In particular, the highest demand, as you'd appreciate, is in Wagga and Griffith, and ensuring that we make the best use of the available theatre time there. We have a range of strategies working at both Wagga and Griffith in terms of our theatre efficiencies. So some of the strategies that are being implemented now at the moment is starting our nursing and operating room staff 30 minutes earlier so that patients are in theatre. Patients are sent earlier to theatre, ready in theatre at the start of that theatre session, and that we have better systems for actually tracking where the patients are, how long their surgery is taking, and having the next patient ready to follow that up. In our emergency services, pretty well nearly 88,000 emergency presentations to our 2 base hospitals year to date to the end of February. Across all of our services, there's been 133,000, more than 133,000 occasions of service through our emergency departments to the end of February. In our base hospitals, of those 88,000 people that have presented, nearly 9,000 of them have required an admission to the base hospital, and that's up about 1.6% from this time last year. So the majority of people that do present to the emergency department don't require an admission, but a significant number do. 85% of people who present to our emergency departments are treated and leave the emergency department either discharged back into the community or being transferred to a ward bed within 4 hours of presenting to the emergency department. And across the district as well, we're favourable in terms of the times between when a person presents and when their treatment commences in all of the triage categories. So continuing to track well in terms of our emergency service indicators. We have a program running at Wagga, has been running for the last 12 months, and as from this year we're extending it out into Griffith, and it's called the Whole of Hospital program. And what that is looking at the hospital as a whole in terms of how we manage patient flow through facilities, and making sure that we're managing our discharge process as well, that we have good referrals into community-based services, and that we have beds available then when people present to the emergency department or we need to put people through in our surgery. And there's a range of things happening under that Whole of Hospital program. So some of the things around direct admissions to the ward by the ED consultant, so when they're assessed as needing a ward admission, currently people may wait in the emergency department until the medical registrar comes down and reviews them and does their full workup in emergency. What we're looking at is those patients being moved quicker to the ward, and that workup by the medical registrar being done in the ward rather than blocking up an area in the emergency department. Looking at where some of our procedures are being undertaken in Wagga, some procedures currently being done in the intensive care can actually be done in the surgery unit. We, in particular, are looking at the processes around transfer of patients from peripheral facilities into our base hospitals, and at the moment it may take about 3 or 4 phone calls to various people in one of the base hospitals to finally plan and coordinate somebody's transfer and admission to the base hospital. By the time they've talked to the clinician or the doctor, and then to the bed manager, and then to various other people that may need to be involved in there. So what we're looking to do is streamline some of those processes, so it'll be a single call to enable a transfer that will link in both the clinicians and the bed managers, so that people are being transferred when a bed's available and at the right time. And also looking at how we might use some of our beds as a medical assessment unit within Wagga. Mental health admissions, and I'll probably have to explain this graph a little bit, but we're seeing increased acute activity since the opening of our new Wagga unit. Basically that new Wagga unit, which has expanded by 10 beds, opened in November And so this purple line here is the activity for the new unit compared to this green line, which was the old Gissing House, which had 10 less beds. Probably more evident in this next slide, which is the number of bed days occupied in our mental health unit. So these purple lines here show occupied bed days since the opening of our new unit versus this green line, which was the old unit. So we that new unit and those additional acute beds are being well utilised. Our Connecting Care program, as of early March, we've now reached 2,000 people currently enrolled in our Connecting Care chronic disease management program. And I think referring back to Gail's earlier comment around people having ownership of their own health and how we actually help people manage their own health, that Connecting Care program for those who have chronic conditions is a key strategy around that, in terms of linking our services, GP services, and giving people with chronic disease, I guess, the tools and capacity to manage their own disease. Over half of our sites have achieved their targets, but we still have a way to go in terms of Aboriginal enrolments within that program, and continuing to look at how we refine that program to make it more accessible to Aboriginal communities. Health promotion, our Healthy Children's Initiative is off to a great start. We've got a fundamental movement skills workshop that have been run at 77 sites and more than 275 participants enrolled. We are running a Go for Fun program, and that's a free program run for families with children aged 7 to 13 whose weight is above the healthy range for their age and height. And we've had a number of children completing the program. And we've recently written to all GPs in the district, ensuring that they're aware of that program and how they can refer people into accessing that program. In partnership with the Murrumbidgee Medicare Local, we've had 17 community leaders trained to provide aqua exercise at Temora, Area Park, Ganmain and Coolaman, so working in some of our smaller communities. Our Oral Health Clinical Network, I've got to say that happening in oral health. They're very busy with funding we received under the National Partnership Program in terms of increasing access to dental services for those that are eligible. And our Oral Health Clinical Network is run across 2 districts, both Southern LHD and Murrumbidgee LHD. So they've established a very good network of how those workers in our oral health services are linked in and have professional support and supervision. We have looked at and improved our processes for ensuring that children who may be going into out-of-home care, so children going into foster or temporary arrangements outside of their normal home setting, are assessed very quickly in terms of their dental needs, dental hygiene and dental care needs. Aboriginal health, we've recently run a diabetes camp, and that had more than 70 participants attending over the 3 days, and that was a fantastic partnership initiative that gave people the opportunity to discuss diabetes and learn about the associated health risks. We are running right across the district Respecting the Difference cultural awareness training, and it is a priority mandatory training program for all of our staff, and that is being rolled out by our Aboriginal Health Unit within the district. And we are also have initiated a quality program that is looking about how we follow up Aboriginal patients who may have been discharged from our hospitals or who have self-discharged from our hospitals against medical advice, so that we ensure that we have a rapid follow-up with those people to check how they are going. Quality and models of care. Once again, going back to mental health and drug and alcohol, we are looking at our whole models of care in that area and how we strengthen the focus in mental health and drug and alcohol service on a recovery model, and also involving consumers in that recovery journey. So that's ensuring that people are not forever defined by their mental illness, and that we work towards them moving on and leading fulfilling lives as members of the communities. It is very much the model that we're using in our new subacute unit at Wagga. So that subacute unit has now, the first part of that has opened in the middle of March. We currently have 7 patients in that unit at the moment, and it is receiving some very positive feedback around that. The length of stay, it's the first time we've had a subacute mental health service. Length of stay for those patients is anticipated to be about 6 to 8 weeks. And so we're still early days yet, so it will be interesting to see how that program works as we go through and have more consumers actually going through that. We have held a mental health consumer forum in Narrandera in the middle of March, and we had more than 50 mental health consumers attend. And you may have seen some of the media coverage around that. There was some very positive feedback from that. There was the program included presentations by consumers of our service on their experience and their journeys in using our services. And also we used that forum to kick off the first stage of our consultation program around a new mental health, drug and alcohol clinical services plan for the district. So that's one of the key service planning initiatives that we have for 2014, is to complete that mental health, drug and alcohol clinical services plan, and I'll talk a bit more about that later. Other things that are rolling out, pathology point of care testing. You may have seen some media on this recently. We are, through New South Wales Pathology, getting new point of care testing equipment in all of our non-base hospital sites. So it is equipment located in the emergency department by which they can staff can undertake some simple pathology tests such as troponin tests and blood coagulation checks. It's linked into the network. It's supported by the New South Wales Pathology Service to ensure that the equipment is regularly calibrated and kept up to date. And it will mean that people presenting to the emergency departments, we can do some routine pathology on them much quicker and easier than to get a diagnosis on them and make decisions about whether they can be cared for there, whether they need an admission, whether they need a transfer. So I think that's a really positive initiative. So that's rolling out, we're currently rolling out those point of care testing machines. It started in March and this month, and we've had to upgrade some PowerPoints and data points in all of the EDs to actually take that capacity. Our radiology digital picture archiving system. This is, I appreciate it's been a long journey, but work is still underway at sites to link them into a network. We are doing some work in terms of ensuring that our systems will link to the various private providers who do the readings of our imaging services, and so some of that has taken a little bit longer than expected, but all of our sites are commencing to go live into linking into that system by middle of June, running through to September. Once again, further computers and equipment and printers to support that process are currently underway. Our Nursing and Midwifery Essentials of Care program, there's a statewide showcase happening in May, and there has been some of our staff asked to present at that showcase around the work that's actually happening within the district. So many teams across the district are running Essentials of Care program, which is looking at how they provide services. And I think picking up on the theme of the video that we saw earlier, which is really trying to look at patient-centred care. How do we improve the experience for people presenting to our services, how do we have a better understanding and deliver services in a way that meets their needs. Our extended scope of practice program, this is a program that we piloted last year with some funding from Health Workforce Australia. It was a proposal that was put up by our staff in the nursing and midwifery unit, and I know Daniel McCluskey up the back there has had a leading role with driving this program. So it's looking at giving competencies to some of our senior nurses in our smaller sites to be able to treat a number of conditions that present simple things like foreign bodies in eyes, some splinting, diarrhoea and vomiting. I'm trying to think of them off the top of my head. So we did a pilot of that last year, which was very successful, and we're now entering the next phase of that program, and we've got another 19 nurses that are enrolled to undergo the ESOP program and get those competencies. We are aiming in a range of our small sites to sort of get to having an ESOP trained nurse on each of our shifts. So we have 14 currently authorised, another 19 now in training. In February, as you can see, across our districts we had 83 shifts covered by an ESOP nurse in our emergency departments. And what that means for us is if it's a simple thing that one of these nurses can treat, it saves calling the doctor out in the middle of the night, or something, if it's something that we don't need to, that gives us some benefits in terms of reduced costs, in terms of, but also in terms of, you know, many of our doctors are on call 24 hours a day, 7 days a week, and if we can reduce that demand on them, then that makes it easier. It also means that in many instances we don't have to transfer a patient using ambulance, so it gives us some financial savings as well. And I've got to say there's a lot of interest in this ESOP program across the state. The fact that we've gone to the next stage is because there was a lot of interest in how the first pilot went, and we got some additional funding from the Nursing and Midwifery Office to roll out. Recently released through the Bureau of Health Information some patient survey results. There was surveys done of over 17,000 people statewide. To survey them on their experiences of the public health system. Of those 17,000, more than 700 people that had used Murrumbidgee services were interviewed. Highlights for us, I get, is 90% of people rated their overall experience in Murrumbidgee hospitals as very good or good. 94% reported that clinicians explained things in a way that they could understand, either all or most of the time, and that was higher than the state average, which was 90%. 94% reported that they were definitely or to some extent involved as much as they wanted to be in decisions about their care and treatment, and I think this comes back to some of the things Gail was talking about earlier around patient-centred care and ensuring that people are involved in their care and their treatment decisions. 88% reported they were always treated with respect and dignity. That's a little bit higher than the New South Wales average, but I've got to say I'd like to see that at 100%. 88% reported that doctors were always kind and caring, once again higher than the New South Wales average. And 86% reported that nurses were always kind and caring, once again higher than the New South Wales average. 71% rated politeness and courtesy of staff in ED as very good, once again higher than the New South Wales average, but I guess they're all things that, you know, you would really hope we get to 100% on those things. Areas to improve, cleanliness of toilets and bathrooms, and also whether a healthcare professional discussed their worries or fears. So we had 40% agreed with that had happened, and whilst it was better than the state, it's still a fairly low figure, and there are areas that we need to work on. Recently, as of last week, the Clinical Excellence Commission comes in and does some regular quality and safety assessments on different focus areas for us, and it's always a good experience to have people, I guess, independent of us come and look at how we're providing services and assess, I guess, where we stand with those. So this last week's quality QSA focused on the areas of medication safety, transition of care, and that was around how people might transition from one part of our service to another part of our service, and that may be within a facility, from ED to wards, or it may be between facilities from one facility to another. And also in terms of how we manage and prevent falls within our facilities and services. We'll await the report on that, but generally the feedback, I think, Gail, from those assessors were fairly positive about our services. So I think to have a level of confidence that there is independent review of the quality and standard of our services, those areas are good. Just thought you might be interested in some of these. People probably heard about the Between the Flags program, and you may have heard things talked about at your LHAC forums about things like colour-coded observation charts. Between the Flags program has been in for a number of years now, and it's focused around, I guess, trying to identify very early on if a patient's condition is deteriorating. So through observations and taking basic observations of patients, if those parameters are starting to deteriorate, there's a zone in the nurse's observation chart that plots where a patient's signs may be falling into a yellow area. So there's a range of strategies that are to be implemented at that stage. So maybe you can stop them falling into a red area. Or if they're falling into a red area, then how do we have a rapid response to that to ensure that the patient's condition doesn't further deteriorate. So we collect a range of data on that, and just for interest in terms of those people that fall into a red zone, generally the majority of those patients then need oxygen, or then, so that's the first line here, oops, wrong line. Or they may need a drug intervention, some IV fluids is the next one, ECG monitoring. So we have a range of data that actually indicates how we respond to people and when they fall into the red zone, and how we, what our outcomes for those as well. On an annual basis, we run the Murrumbidgee Local Health District Excellence Awards, and yes, the winners of the Excellence Awards are also then submitted to the New South Wales Quality and Excellence Awards. So we have recently opened up the nominations for our Excellence Awards, and I'd encourage you to be talking with your managers around what projects from your local sites they're going to submit for those Excellence Awards. There are 10 categories. Entries close in the middle of June, and we're looking to hopefully get entries from all of our services. And it is a good opportunity to acknowledge the range of work that is done in each of our services. And I talked about QSA earlier and the Clinical Excellence Commission, you know, reviewing how we run our services. The other thing that we are undertaking is National Standards Accreditation, which all health services across the country are required to undertake. Our staff have been working on preparing for accreditation for considerable time now, and we are commencing our first surveys. So the first surveys will start happening at the end of May, and the first group to be surveyed will be the MIA and Griffith Base Hospital area, and then I think the surveys for the other groups roll out over the couple of months after that. In terms of where we think we currently stand at the moment, we think 97% of our core actions have been achieved to a satisfactory level. There are a range of things where we're expected to be in a developmental stage. We think we've got about 76% of those already reached the satisfactory level. So we're hoping that we're well prepared for those accreditation surveys. Just some information around some of the home and community care programs and contracts that we're running. So we, separate to what we are funded for from New South Wales Health in terms of our core business and core services, across our district there has been some funding for different services received for home and community care programs for a number of years. A number of those contracts are finishing at the end of June. And as you'd be aware, the Commonwealth in a range of areas is looking at how they purchase or contract services in a range of areas, including things like the National Disability Scheme and so on. So they are moving to new models around that. We did have a number of contracts coming up at the end of June. There is some work currently happening by the Commonwealth Department of Social Securities and the Department of Ageing and Disabilities in looking at other service providers that may be available in those communities for providing the services that we currently provide. And they include some areas such as centre-based daycare, some Meals on Wheels, some respite care programs and so on. Doesn't include LHAC community nursing and podiatry services. So home and community care are currently scoping the availability of other providers in each of those communities. If there is no other alternate providers for those contracts, then Murrumbidgee has undertaken to continue to provide in those services into the new year. We probably won't know in terms of the outcome of their scoping work until the end of this month. So, but if we are transitioning those services to other providers, can I just assure people we will do that on a very planned basis and to ensure that there's continuity of services. I just like this photo. I just want one of these shirts. This is the dragon boat races and regatta in Albury, which was held recently, and this is a team that was made up of some of our Aboriginal clients, some of our Albury based staff and Aboriginal health team members, and Sarah, you came 7th. So we're planning that they're going to come first next year, but I think we had this team, and there was also a second team from our Albury office as well in the dragon boat races. But I've got to get myself one of those shirts, I think. In terms of just generally some of our workforce things, you've seen this graph before. It is around recruitment and I guess one of the key focuses in our strategic plan was around how we can stabilise things like our medical and nursing workforce, and a reflection of that is, I guess, a reduction in our use of locums because we've been able to fill positions. So this is the Wagga graph going back a couple of years, and as you can see, downward trend. This is great work done here at Griffith where we've significantly improved our permanent medical workforce here. So we continue to do quite well. It does sort of fluctuate a little bit, but overall downward trend. Once again, graphs that you've seen before in terms of our agency nurse usage, and the grey lines here at the end are this current year compared to the red lines being last year, and the blue lines the year before. So we continue to improve I guess, recruitment to our nursing positions across the district, which is great. And this is shown then in this in terms of the number of vacancies that we had. So going back when we first became a district, up around 200, to these grey lines now where we sort of run between 40 and 50 nursing vacancies. If you think of that in the context of we have about 3,200 odd staff overall, about 2,800 odd full-time equivalent staff. So that's a pretty low vacancy rate. Workers' compensation, once again, you can see where we were to where we are now, so we run on and we've had a lot of focus around ensuring health and safety within our workplace and also return to work programs for people. One of the things that you may have heard about over the last month, March was a very big month, we put out a bit of a challenge amongst our staff. When you think about it in the context of how many staff we have, it actually makes up quite a big proportion of our population. So as much we're interested in the health and welfare of our staff. One of the things that was done over March was a bit of a challenge for across the staff to get together teams of people and to try and achieve 10,000 steps a day. I've got to say the CE didn't quite make it, but I'm very cranky because the rest of my team didn't. We're supposed to sort of lift the CE's team's average percentage, but I'm not sure where we ended up. But we had a large number of people participating in that, which I was just actually blown away with the numbers that actually took this on board. So we had over 900 staff and 70 teams around the district participated in the challenge. Team average was in excess of 11,000 steps a day. Total steps for the month was 282,000. They walked more than 225,000 kilometres, and we walked 86 times around Murrumbidgee or 6 laps around Australia. So I think that was a great effort, and I've got to say I'm glad the rest of the staff supported their CU because the CU didn't quite meet that. But I think it is important that we think about it. But I think as well it was probably a big learning experience for staff as well in terms of how little or how much exercise we do get in a day. But I think that was quite a fun initiative that was really well received, engaged by staff. Got a mixture of things in here, haven't I? Just wanted to let you know that yesterday we did issue a public health alert, and there has been some mosquito-borne viruses detected. So in Deniliquin, there's been some detection of Murray Valley encephalitis, and also in Leiden, Kundran virus. Both of those are mosquito-borne viruses, and I guess we are issuing safety alerts and in your role in LHAC, I guess in terms of raising the awareness about people trying to avoid being bitten by mosquitoes by taking some simple steps. Avoid being outside at times when mosquitoes are active, which is particularly sort of the evening or early morning period, using mosquito repellent and being careful when using that with children. Looking at any mosquito breeding areas around the home. I've got to say, when so much rain and water around, that's going to be a bit difficult at the moment. And fly screens on windows and doors and so on. You know, it is just, we do live in an area where some of these mosquito-borne viruses are known to exist, so it is about protection. And the other big health message at the moment, okay, who's had their flu shot? Wow. Well done, well done. Yeah, so we are doing a big campaign for both our staff, people visiting our facilities, around getting flu shots and making sure that people don't bring the flu into our facilities because it is very easily transmitted once it's there. Other things happening in work in our workforce, and we've continued to maintain a focus around education and development of staff. 8 people are graduating this year. They're coming to the board meeting in April to get their graduation certificates from our clinical leadership program. We have another 14 people enrolled in that program for this year, and we've had 79 people who are in management positions or aspiring to be in management positions undertake a financial management education program. More than 75% of them have completed to date, and the rest are continuing in that work. Nursing and midwifery, a lot of focus, as you know, about growing our own workforce. So we've got 50 newly graduated nurses commenced the transition to professional practice at hospitals throughout the LHD in February, and another 8 will be coming in August. We have 11 student midwives, including 3 recipients of NAMO scholarships that also commenced at the beginning of February at Denny, Griffith, Leeton, Tumut and Wagga. Right, that was all the good news, guys.
No, leave now.
I'll be first out the door, Gail, as you know. Look, we've always been open and honest with you about our finances, and I've got to say this has been a really difficult year, and things are not good. Performance, so our finances year to date to the end of February were unfavourable by about 6.3 million. We're projecting more than $10 million unfavourable. We're just working on the March result at the moment, but I've got to say it's looking similarly higher than expected. We probably weren't tracking too bad up until December, but I don't know what happened at New Year's, but January, February, March has been a bit of a killer for us. Well, I've got to say we are in ongoing discussions with the Ministry about the financial position. They have given us some cash support to date, and that's meant that we are ensuring that all our creditors are being paid within the 45 days. It does mean that we've been able to meet our payrolls and so on. But I guess it is a very difficult situation. We have improved, up until this year, we've improved our financial position every year, but this year it's looking like we are going to be in a similar sort of position as where we ended last year. And that's a disappointment for us because I know how difficult how hard everybody works in trying to ensure that we improve our efficiency. So I guess message is $10 million is a big bucket of money, and we have to do something about turning that around, and as we progress discussions with the Ministry, we'll try and work that through. There are things that I guess do impact us, and whilst I'm talking finances, I actually wanted to talk a little bit about things that impact our finances, but also when I have sleepless nights about we haven't balanced the budget, I also have moments when I reflect on the system and the services that we provide and what we do on a day-to-day basis. And I just wanted to give you a bit of an example. I know Jason's here from Hay. Is there anybody else here from Hay? Hopefully you don't mind if I relate this, which is very timely. People may have heard in the media last week that there was a bad accident outside of Hay, so 30 kilometres I think west of Hay. All of you people sort of will get the understand how sort of far across the state that is. There were 8 children and a truck driver injured in an accident between a semi-trailer and a minivan. It did require us to activate our local disaster area, and Paul Richard's standing very calm over there in the corner. He was our health service functional area coordinator who manages disaster management for the district that week. Ambulance, I just thought this was a really good example to think about how the whole of the system responds, not only on a district level but on a range of levels. So from the ambulance, they pulled in road resources from a range of areas. I think, Jason, you were saying about 8 ambulances came in to manage this, and they were taking ambulances from Lake Jellicoe and other places. All patients were transferred initially to Hay. From Griffith, they sent a doctor and 2 nurses were sent out from Griffith Base Hospital to assist the Hay staff. There were intensive care paramedics flown in. There was a helicopter came up from Bendigo, and 2 planes came from Sydney and Canberra with intensive care paramedics in there. We have a critical care telehealth camera in our ED at Hay, which was installed about 12 months ago. And that was used to link into the ED specialists in Wagga. All of the patients were stabilised at Hay Hospital, and that included one of the patients who was in a very critical condition, needing to be intubated, and very much I think that was well supported through the telehealth system and under guidance from the Wagga specialist. And at the end of the day, there were 3 fixed-wing aircraft and a helicopter then used to transfer patients, 5 of whom went up to Westmead Children's Hospital, another went to the main Westmead Hospital, and another 2 went to Canberra. So quite a significant afternoon. And I wanted to, I'm going to read to you from an email I got from Gail Buatti, the manager at Hay, because in addition to that, she talked about what happened at Hay. So she's saying, in order to provide the best possible care to the steady stream of patients arriving, afternoon nursing staff were called in early. The child and family nurse from community health came across and specialled. There was a 6-month-old baby as in that accident. So the child and family nurse came across and provided one-on-one care to that infant once he was stabilised. Community nurse, who is FLEC trained, frontline emergency care trained, also came over to assist, and they called in extra nursing staff as more patients arrived. The health share staff, who look after all of our cleaning and food services, ensured that all the patients, including those that were in the hospital as well, were all fed on time, and that the staff and the visiting emergency workers had access to refreshments. Also, as soon as the last patient left the facility, 2 health share staff did a thorough clean of the wards used and the emergency department, so that by 8 p.m. that night the facility was spotless and ready for full use again. By this time, the nurses had restocked the wards, determined that they needed some more essential supplies, including 2 units of blood, some drugs and some other equipment, and they were sent out from Griffith Hospital in a matter of hours. The administration staff had fielded calls, sought information as requested by staff, faxed documents, and ensured paperwork kept flowing, which allowed the nurses to stay with the patients, and the maintenance person activated the helicopter pad procedure, which ensured that the landing and the departing of the helicopters was seamless. In all, as you can imagine, there were a wide range of services involved, not only ours, but ambulance service, retrieval teams, the police, the fire officers, SES workers, and the local Catholic priests were all involved in managing that incident. But I think it's a really good example of how services, and these are the sorts of key things that we as a health district are I guess part of our core business is around responding to emergency needs, and all of those things came together and I think provided the best possible care in that instance in a place that is very isolated. The reason I'm putting it in the finance is I've yet to get the bill for all of that. I'm quite sure, so I'm just flagging for the board, April's not looking good, guys. But I think it is a tribute to everybody that was involved in responding to that. Just to let you know, this is our staff. Keep flicking staffing. Yeah, March, whilst I know we haven't got the March result, February our staffing results are and yeah, all of that summarised in the above. Just to let you know, 2014-15, so we are in discussions and have been for a number of months with the Ministry about 2014-15. We won't know our budgets and finalised service agreement until after the state budget is handed down, which will be I think about the second week in June. Commonwealth budget comes down in May, state budget comes down early June, and we'll probably get our final budget allocation towards the end of June. We are working on them. There needing to be some growth in activity. I've been in health 30 years. Every year our activity goes up and the demand goes up. We are likely to have increased revenue targets expected of us. And as soon as we get our final service agreement and budgets, we'll be looking to also finalise those for each of our services by the end of June, so that they go into the new financial year. I guess I have an expectation that next year will be as tough as this year in terms of our budgets. I'm back to the good news stuff now. So a range of things happening in terms of surgical, in terms of service planning. People would be aware our surgical services plan, there's a draft of that that's been released for consultation, as have our aged services and our rehab services plan. There have been things in development for a period of time, so it's nice to see those coming together. We are looking to finish off a process in terms of having clinical service plans for all of our small facilities, and we have targeted for this year to have done by the end of 2014 some clinical service plans for Totemore, Colquay, Holbrook, Maryborough, Harden, Tumbarumba and Hay, and we'll be doing those in consultation with the relevant LHACs and communities. So just to flag that we want to do some work in terms of looking at your particular service needs in each of those communities. We have 8 sites. So every 3 years we have to review our services in our NPS sites. And it is often the opportunity to look at how the needs have changed and what we might need additional to what we have now. And we'll be doing 8 of those this year. Mental health, drug and alcohol clinical services plan, as I've said, currently rolling out. That's our next big district services plan that we're targeting this year. In terms of assets, there's a range of things that we've continued to try and progress upgrading our facilities and services. We've put solar installations in at the new facility, new MPS facility at Lockhart, and also we have new premises here for the mental health team in Griffith, and that's had a solar panels installation as well. Upgraded medical imaging rooms in Griffith and Tumut is about to happen, so May, June we're targeting doing some work in both of those sites. We've had new emergency generators for Burrawa, Harden, Young, Holbrook, Narandra, Coolaman, Urana, all done since about November last year and rolling through to the end of June, so that's our plan for there. New theatre tables for Wagga and Korowa, air conditioner upgrades at Leeton and Jerilderie. We are currently just ordered some 8 new anaesthetic machines for Wagga, Tumut, Young, Temora, Narandra and Cootamundra. New anaesthetic monitoring systems for Young, Cootamundra, Tumut and Narandra. We have been given some funding for 15 new LifePack ECG machines, which will be rolling out. New monitoring system and anaesthetic machines for Korowa and Denny were put in June, and Tumut, West Wyalong and Holbrook we're looking at replacing the mobile X-ray facilities there. So we continue to, and we just don't tell the finance people up in the ministry that we continue to spend money to try and upgrade our services. Some work happening here for under Rural Health Minor Works program to upgrade the maternity unit here, so 720,000 upgrade to that maternity unit. Tenders have just been awarded for that, and that will include refurbishment of 2 birthing units with en-suites, an upgraded assessment room for pregnant and labouring women, and improvements to the waiting rooms, toilets and clinical utility areas. Lockhart, anybody here from Lockhart? How's it going? Wonderful. I've got to say we had the best community open day on a Sunday. So the new multi-purpose service at Lockhart is now open. We had a community open day there on the 22nd of February, and I didn't think we were going to get all of the community out of. There's a really nice at the front here. At the front here. Very nice sunny sunroom area that overlooks the cricket oval. And everybody came in here and goes, oh, we could watch the football from here. So I'm sure it's going to be a very busy place, but I think to me it looks like a brand new built facility. It's been a difficult sort of 12-18 months for staff as they refurbish that facility, but I've got to say it looks like a brand new facility. Hillston, so we're progressing. We have just awarded the main works contract, and that tender's been awarded. I think they're looking to be on site. So the early works have been completed, and the main contractors, I think, are looking to be on site in the middle of April.
After Easter.
Yeah. Wagga, as you know, we've opened the mental health, which was stage 1. The first part's of stage 2, which was a whole new mortuary and loading dock area, and that will sort of have to be done first to clear the way for this big block of dirt. So we've knocked over all the buildings at the back of the existing hospital. Since that time, there's been big pilings put down, and they actually have started to pour the concrete in some places there. In addition, we've had $400,000 allocated to us to do the planning for what is stage 3, which is the areas that aren't included in the current funding. So that is, I guess, very positive signs that they're now asking us to progress the planning for that, the funding for the next stage will also follow on once we've finished stage 2. And that will include things like ambulatory care, so all of our community health services, rehabilitation, pathology, and some proper education and training facilities. And I think, if we've got time to do this session. I think that the design's changed a bit as it's gone through. So that, hopefully that gives you a bit of an idea. If you look at the if you see the footprint of where it's being built on the land now in terms of the footprint of our current hospital, it's probably twice the size of it as well, and going up to having helipad and so on up on the top. And I think that's it from me.